how do I make this super effective? So I jump into my chamber and I get out absolutely reversed my age 10 years backwards and stuff like that. How do we make it happen?
What chamber are you using? How much pressure are you using? Are you using oxygen or are you not using oxygen? What other issues do you have that you haven't told me about? Nobody's talking about off-label use of hyperbaric. I've taken a dozen or more courses in hyperbaric, and that is a topic that is completely ignored. Very excited to be able to come join you in Spain, and we're going to offer this off-label functional medicine style hyperbaric course.
17 years of Dr. Jason's experience and 11 years of mine. That's 28 years combined of teaching, researching, studying, practicing hyperbaric therapy.
We're trying to help people here, and if we keep secrets, we're never going to have the impact that we know, you and I know, that hyperbaric can have.
Welcome to How to Hyperbaric podcast, a place where we discuss how to improve health with hyperbaric therapy. And it's my absolute pleasure and privilege and honor to introduce to you my colleague and my friend, Dr. Jason Saunders. Dr. Jason is a thought leader in the field of hyperbarics. And I happen to know a lot of people in this industry, and everyone looks up to Jason with admiration. Jason absolutely dedicated last 17 years of his life to studying, learning, researching, teaching, and practicing hyperbaric therapy. Today's episode will focus on different aspects of hyperbaric therapy, but it will be absolutely useful for people who either own a hyperbaric chamber for their home use or for clinic use, or are planning to get one. And they're excited that they're going to have this piece of equipment, but they're also nervous at the same time because you really want to make sure that you're operating your chamber safely and effectively. So this is what we're going to talk about today. Welcome to the show, Jason.
Dr. Masha, so great to be here. Thank you so much for having me on.
Yes, I'm super excited to have you. This is our third episode, and if you guys haven't watched the first two, you can do that. It's on our YouTube channel. It's also on Jason's YouTube channel. Jason has an amazing YouTube channel, which is full of different information about hyperbaric therapy. Information is in the links in the podcast description. And today I wanted to focus on two different aspects of hyperbarics: safety and effectiveness. Let's start with effectiveness. Everybody is more concerned, like, how do I make this super effective? So I jump into my chamber and I get out absolutely reversed my age 10 years backwards and stuff like that. How do we make it happen?
I appreciate the way you described the YouTube channel. It's been, a labor of love getting all of this information out there. And you could imagine the number and types of different questions that I get. But, probably one of the hardest questions I get is people constantly ask me for protocols. Hey, what's the best way for this? What's the best way for that? I have this problem. My dad has this problem. I have a patient coming in next week for this. Like, what, number one, I can't give advice like that through the YouTube channel. So that's usually, unfortunately, my answer. But part of the reason for that is that there is no singular protocol. What chamber are you using? How much pressure are you using? Are you using oxygen or are you not using oxygen? How available is this chamber? Are you traveling 2 hours each way for you to do your sessions? Do you have one in your living room? What other issues do you have that you haven't told me about in the little message that you sent me on YouTube? There's 3 other diseases that you're potentially fighting. Do you have any other comorbidities that we would need to know about to make that? So I say that just to say there's so many ways to make an effective protocol. Ultimately, we have 3 major variables that we're using: the amount of pressure we're using, the percentage of oxygen that somebody's breathing, and then the frequency and the duration that we're setting it up. How many times a week, for how long each session, etc. And we can manipulate those 3 variables so many different ways to make effective and useful protocols. The key is understanding physiology enough, or understanding what your health goals are enough to say, well, if this is what I'm trying to create, okay, and this is the equipment that I have, now how do we create the best protocol? And again, there's no singular answer, but we spend a lot of time on this. As you well know, I'm sure we'll talk soon about some of the courses and things that we teach and that we'll be teaching. But we spend a lot of time in that setting talking about this because there is no single answer. What I try to deliver to people is a thought process. How can you think through those three variables mixed with understanding either yours or the person's health concern and or health goals? And how do we combine those together to make something that's meaningful as far as, protocol goes?
So going back 17 years ago, when you got introduced to hyperbaric therapy and you told us your story, I think first time you were on a podcast, how it really helped with some neurological pain that you were having, right, in your foot. And then obviously you got interested because the story is very similar, how people get introduced to hyperbaric therapy. And then I believe that you wanted to apply it in your practice because you were a doctor of chiropractic medicine. And as you know, and as everybody knows, this information, it's not available. That's why people keep asking those questions. So for hyperbarics, because it's such a new branch of medicine, yet it's not, but the way we use it now is new, right? So we can't just go to a regular protocol, use it and apply it. So when you started applying it, how were you putting together those protocols?
Yeah, I mean, back then I did probably what most other people do is, look through the literature as best as we can and try to pull out, or try to mimic, some of the protocols that we see in the literature. Now, sometimes that works out perfect and sometimes it doesn't. And sometimes the research protocols are necessary to follow exactly that way. And again, sometimes they're not. There's really, I mean, today there's far more research than there was back 17 years ago. I started to look, there was nothing. So what did everybody do? Everybody did 5 days a week, 60 minutes at a shot, 40 hours, right? 5 times a week for 8 weeks, right? That was sort of the deal. And that's, even that concept is persistent throughout the literature still, and, throughout a lot of the treatment protocols. And it's not like that's wrong. I would say that hyperbaric is cumulative. So unless you're doing consecutive sessions, do you always have to do 5 a week? No, you could sometimes do 2 or 3 a week. And sometimes you could do 8 to 10 hours a week, right? So it varies, but you certainly need some consistency, especially in the beginning. And then you need it over a period of time. You can't just do 3 times a week for 2 weeks for most cases and expect, dramatic results. You do need to do this for a series of weeks or months in order to really get the majority of the benefits. We often, when I talk about hyperbaric, I break them into like short-term benefits and long-term benefits. So there are certain benefits. I don't want to make it seem like there aren't. There are certain benefits that everybody will get almost every session, right? Every time you go in, certain things will happen. But what most people are looking for like real tissue healing or real longevity related, like the stem cell responses and the new vascular growth and the neurogenesis, all this kind of stuff. This is more the long term. So, unless you're doing 3 or 4 or 5 or more a week for 6 to 8 to 10 or 12 weeks, that's where a lot of those changes come in. So, I started where a lot of people started, like a very firm 5 hours a week, 8 weeks, 40 hours, and then assess to see what happens. And that's could be a good starting point for a lot of people. But we've gotten so much more specific over the years because I've seen that certain things really don't need that much. And other things aren't getting better unless we're doing a lot more than that. As you well know now too, I didn't realize how many different pressures are being used out there at that time. And so you could do, a certain protocol at 2 atmospheres, and it's just going to be different if you're using 2.5 atmospheres. It's going to be different if you're using 1.5 atmospheres or 1.3 atmospheres. So, the pressure ranges make a big difference too. So sometimes you might have somebody doing a 40-hour protocol at I don't know, 1.5 or 1.7 atmospheres, but you're going to apply 1.3 atmospheres. So how many more sessions is that person going to need potentially in order to get a similar result? That's one way to think about it. So again, there is a lot of detail, and you're right. Forever, I mean, my journey through this was through frustration in, it seemed like hyperbaric secrets. Why won't anybody just tell me the answers I'm looking for? Why is it like there's 10 protocols and everyone's name is attached to them and nobody will tell you what they are? Like, we're trying to help people here, and if we keep secrets, we're never going to have the impact that we know, you and I know, that hyperbaric can have.
Yeah, and I'm glad that you mentioned the effects of hyperbaric therapy, because for me, the real change started when I started to look at the protocols through the lens of the particular effect that hyperbaric therapy has. For example, what am I looking at? Stem cell mobilization, or am I looking at angiogenesis, right? The creation of new blood vessels. Or maybe I need to decrease inflammation. That's one way. And you mentioned secrets. And maybe secrets are there because nobody really knows, because it's not an exact science. There's also art to it, right? That comes from your experience. As you mentioned, there was a protocol which was 60 sessions and everybody was doing that. And then while you were doing that, you realized that some of the people didn't need that many sessions. And some conditions needed way more sessions. So this is basically knowledge plus your experience and combination of both, right? Packed together. And
Absolutely. And, when we talk about effect, we talk about, the mechanism of action. Like, what is the thing we're trying to accomplish, right? So, hyperbaric's got about a dozen very well-researched mechanisms of action. And those go back to even the more standard or the more traditional uses of hyperbaric. So like, these are not controversial mechanisms of action. Everybody knows that hyperbaric chambers are able to do X, Y, and Z. Things like you just mentioned: reduce inflammation, improve immune system function, improve tissue healing and regeneration, stem cells, angiogenesis, increased mitochondrial function. These are things, anybody can look in the literature and find examples of. These are well-documented mechanisms. So, one of the things that we're trying to shift in the teaching is to stop talking about this person has this disease, what's the protocol for this disease? More like, as a result of this disease, we're seeing these issues in their health. Because you could have 10 people with the same disease who are expressing 10 different versions of that disease, right? And so rather than a protocol for the condition, I think that's exactly the right way to think about what you said is, what's the right way to apply this tool, this therapy, for this set of goals, right? I'm trying to reduce this person's inflammation. Okay, well, here's a protocol that can reduce inflammation, regardless of what the condition they have happens to be. This person really needs stem cell mobilization in order to heal and regenerate some tissue. Well, it really doesn't matter what the condition is. We're trying to mobilize stem cells. Here is a program that can help do that. And that's, I think, the future of hyperbaric is absolutely in that thought process of applying hyperbaric for certain mechanisms, not to heal, treat, or cure certain diseases.
so it's a matter of understanding human physiology, right? What hyperbarics does to human body, what effects it has, how it correlates with the condition that this person already has. And I like how in one of your videos, when you were talking about what's the protocol for a healthy person, you said that nobody is 100% healthy. Is that correct? I mean, we're all trying to get to be as healthy as we can. That's very different from being 100. So there's always an underlying condition. That's what I'm trying to say. And for me, the course that you're teaching, I took the course through IBOM, and although I was practicing hyperbarics for 10 years, by the time I took it, I still took a lot of information out of it. The way it's structured in there, I absolutely loved it. So I took the course, and I live in Europe, and I decided to bring this course to Europe because here we even have less information available than you guys do in the States.
There's more secrets in Europe than there are in the States?
I don't know, maybe less desire to get things structured. I don't, maybe secrets. I don't know. Maybe that's the way to think about it. But even if there's secrets, we're gonna tell the secrets, right? Because that's the goal, right? To spread the word about hyperbaric therapy and how to apply hyperbaric therapy. Because what makes it effective is knowing what you're doing, why you're doing, and when you're doing it, from my understanding, right? And how to combine it with other modalities is also super important. So
Yeah, when I started taking classes, I was taking classes because I knew, I'm like, listen, if there's a program that I can learn more about the art that I'm trying to, just like I would in anything else, functional medicine, chiropractic, or anything else that I do, I should take these classes. So I started taking classes and I realized, the history is the history of the field. That's really not going to change all much, but we should know where we came from and what our roots were set in. So I think it's an important piece. The science is the science. Hyperbaric science is what it is. You could take that 100 places. A lot of the concepts will be the same, although I think we have an interesting kind of vantage point on the science, and that allows us to really help people understand hyperbaric science in a deeper detail, not just memorizing laws, but really understand the concepts behind the science, which also helps people, I think, communicate about hyperbaric more effectively, whether that's to each other, to other healthcare providers, to patients, etc. But nobody's talking about off-label use of hyperbaric. I've taken a dozen or more courses in hyperbaric, and that is a topic that is completely ignored. And yet there are hundreds, if not thousands, of clinics or people operating chambers all over the world for off-label use with no real way to get an education on how to best do that. And that's really why I had written the original version of this course and took it to IBUM and worked with IBUM to really structure in a way that it can fit the standards of what an IBUM, International Board of Undersea Medicine course would offer. And that's kind of where that was all brought together. But I'm really excited, Masha. I mean, we're gonna I guess we could talk about that, right?
yes,
So we're
I don't want to
bringing
keep
it,
the big secret a
we're
secret.
bringing, can't keep secrets. So, you know, I'm very excited to be able to come join you in Spain, and we're going to offer this off-label functional medicine style hyperbaric course to audiences near you, which is I couldn't be more excited to do it.
I am also so excited, and I'm especially excited to be able to do it with you. So to be able to learn 17 years of Dr. Jason's experience and 11 years of mine, that's 28 years combined of teaching, researching, studying, practicing hyperbaric therapy. I think it's amazing. And the course is in June in Madrid. And the dates are 18 to 21 of June 21st.
Yep.
And what really makes me happy that it's for functional medicine, because I also took a lot of courses and I did masters in hyperbarics here in the university in Spain. And it talks about FDA approved indications and heavy diving material. And it doesn't even touch on function of off-label uses of hyperbarics. And it doesn't put what I really like about the IBOM course, how it connects the mode of action, the effects of hyperbarics with people, what these people are feeling, and how we can help these people get better, and how we can make this therapy more effective, and of course, safe. And now I want to talk to you about the safety. Because hyperbaric chambers, especially mild pressure ones, are approved for home use. Why are we still concerned with safety?
So a few things. One is I would say hyperbaric is inherently safe and unbelievably powerful in what it's able to do for people. And that's rare in medicine in general. To have something, usually you're balancing the risk reward type of relationship. And in this case, we're using something that really is incredibly safe and yet still has, quite an impact on people's health on a regular basis. So, especially when compared with other modalities in medicine in general, it's not even, safety is far less of an issue, right? But number one, people don't really recognize that there's different kinds of chambers, right? Some are pressurized with air, some are pressurized with oxygen, some are low pressure, some are high pressure, some have additional oxygen, some don't. So there's a range of different setups, and understanding each one and what their benefits can be, and then understanding each one what their limitations might be, and then understanding the safety around each one. To your point, I mean, one of the things that we talk about as an example is the most common injury in hyperbarics is middle ear barotrauma. And even that is, I think it's less than 2% of the population. So it's not incredibly common, but that's still the most common. And the most common injury happens in the first 10 feet of a dive, hyperbaric chamber or water, which, let's say mild chambers going to like somewhere between 9 and 15 feet of water. Well, that's even without any of the other concerns with regard to explosions and oxygen and all the things that we could talk about with safety about hyperbarics on the scale of all the different types of equipment that exist. The number one risk factor is middle ear barotrauma, and that's absolutely something that can happen even in a soft chamber. And so even if it's just to understand that different people equalize their ears in different ways, and that if you're being the responsible person, introducing somebody and potentially operating the equipment or recommending the equipment, you should also be the person helping them and recommending to them how to manage those pressure changes to keep them comfortable and to keep them safe, so that there is no, issues with even something as simple as middle ear barotrauma. I want to just add to that is just, if you're doing, especially if you do this for a living, this is not a short-term relationship. This is a long-term relationship with patients. And so most patients or clients that are coming in, they're scared. They've never done this before. They don't know what this thing is. They see pictures or read things online. They don't really know what to expect. The more we can answer that, the more comfortable we can make them feel, and the more successful their first session is, the more likely they'll stick around long enough to maintain that long-term relationship. If they're scared and you rush them and then you injure even something simple like their tympanic membrane on their first session, then they're less likely to really be so excited to stick around long enough to actually get the benefits. And so even something as simple like that, I think it's so important just to be well-versed in that conversation, to really make sure that we're keeping people not just safe from injury, but just feeling safe and feeling comfortable coming to you for therapy.
Yeah, and most of the clients that come to me, their concern is how to communicate with their patients. And you mentioned that too, right? Because it's important. First of all, we need to know the language to communicate with other health practitioners when we operate a hyperbaric chamber, but we also need to know how to communicate with patients, because they might be scared, maybe they're not sure, maybe they read something about a multi-place chamber and that something happened to it in Italy, I don't know when, and now they're concerned. So you need to be able to address that if you're a hyperbaric provider. And course gives that confidence. Even if you're already operating the chamber, even if you're already talking to your patients, you sort of, when you gain the confidence, you transmit that confidence. When patients read that, and when they read it, they feel more comfortable using hyperbaric equipment, because this is what we ultimately want. We want these people to get better. And for them to get better, they need to get inside that hyperbaric chamber. And they could be scared, they could be claustrophobic. I have that problem with patients who live in other countries, and you probably also do, Jason, when they go for their hyperbaric treatment somewhere else, and maybe you give them an advice on a protocol or something, or you work with their practitioner, and then they go to that center, they're being rushed, maybe they're claustrophobic, and they never come back.
Right.
And all that work that you did, all this beautiful protocol that's supposed to make them feel better, they're not going to be using it.
Get a chance. Yeah.
Yeah. I feel really sorry when I hear these stories, because it's a missed window of opportunity to help somebody get better.
Yeah. I'm always surprised. I mean, in these courses, we have a mix of people. Some people are just operating their own equipment. They just want to make sure that they're using it the best way possible and the safest way possible. And, so they come to a course like this. Or some people are thinking about offering hyperbaric, but they want to learn more about the science and understand, some of the structure of what that would look like before they go and invest in the equipment and everything. And so they're coming to the course first to learn something. And then there's most of it is folks like me and you who had been doing it for years, but wanting to learn more. And those everybody else is expecting to learn something, dramatic, because they're coming into it with very little knowledge. It's always interesting that the folks who've been practicing for a long time, even those who've been certified in other places, but consistently those people are like, I had no idea that there was this much to learn about hyperbaric. And it's like, it's a systemic therapy. It's not a targeted therapy. And when you're dealing with systemic therapies, there's so many different avenues to go down to understand the pathways that people see change and improvement. But there's also so many ways people experience the chamber personally, some positive, and some with like adverse reactions. And again, I always tell people coming to the class, the goal of the class is to become confident. Because like you said, through confidence comes patients feeling or clients feeling safer, more able and willing to do the therapy. And what we offer you is literally, like you said, you're 11 years, my 17 years. We're offering you 28 years of clinical experience, 28 years of confidence, and we'll be sharing stories and we'll be sharing protocols and we'll be sharing all the experiences that you and I have had through all these years working with clients. And the good, I am as transparent as humanly possible in these classes. I will tell you all the good stories. I will tell you all the bad stories, and please don't think I don't have any. And so, but we learn from those. That's the whole point. And as we learn from those, we correct them. And then you get to learn from them before you do them through me. So, and through you, Doc. And so, that'll be, I think, some of the most valuable pieces that people get from a course like this is just you and I sharing things, from our experience.
I agree. This is called mentoring because you take your experience, you pack it in 5 days, and you just give it to someone instead of, spending 15 years and making the same mistakes and trial and error and, making conclusions. And some of it works and some of it doesn't, and you're back to square one. You basically get all this information, and we're going to be answering questions. So questions like what to do with a client who maybe feels tired after a hyperbaric session. This is where you can get the answer. You can sign up going to hbotusa.com under the training. Am I correct?
Yeah, we have two sites, HBOT USA, and there's usually a header that says like take us to the next course. Or there's actually a website, thehbotcourse.com, and all the courses are also listed there. But yeah, either way, they all kind of funnel to the same place. But that's where you would register for the course. It has some description of what the course, what to expect, and then we're listing in there, the location, nearest hotels, nearest flights, all the information that you sent us about, how to get there the easiest, and so all of that will be in that description.
And if people have questions about the course, is there an email there, right? That they can.
Yeah, I mean it's support@hbotusa.com. So any questions, if you end up on one of those pages and you have a question, there'll be a way to just send that question, and that's where it's going to go. Or you could just email support@hbotusa.com, and somebody on my team will see that and answer those questions accordingly for sure.
So this is for European community and people from Asia and people from Middle East, because it's much easier to fly to Madrid than to fly see Jason in the US. I mean, you can always do that, but here is the chance to see Jason in Europe and, learn from the best, really. Besides the fact that this is an amazing curriculum, the course is just, for me, after doing masters and taking multiple courses, I think I got the most structured information in this course. But apart from that, it's asking questions, being part of the community, you know, and talking about hyperbaric therapy for 4 days straight. I think it's just super opportunity.
Everybody gets a lot out of it every time.
Both of us, by the way, are going to be in London a couple of days before that on Health Optimization Summit. And Jason will be speaking at the summit. So if you're in London and you want to visit us there and maybe talk about the course a little more, just sign up and come to Madrid.
And then you can come with us from the from Health Optimization Summit. We'll all travel together to Madrid.
Yeah, and have fun in Spain. Jason, thank you so much for taking your time and giving us.
I'm so excited to see you in a few weeks.
Me too. I'm super excited. Can't wait. And guys, we'll hope to see you soon in Madrid.
Take care.